Welcome again to Colorado Spine Therapy. As you may know or not, physical therapists work with injured tissue, which is entirely different from healthy tissue. That's why it's not related to fitness, at least not as directly as people think. Injured tissue, for example, the repetitions you work with are entirely different from fitness or pure strengthening like bodybuilding or whatever, weightlifting. So that's a distinction between those two forms of exercise. Therapeutic exercise, what your physical therapist is doing, and your trainer, for example. Both have value, of course. Now, a physical therapist can also look at the way you move. Are you moving as efficiently as possible? Let's say you're a runner and your right hip is somewhat stiff. A physical therapist can detect that during an evaluation and tell you, start doing this stretch, because if you don't, 6 months down the road, a year down the road, you run a risk that you overload your hip and then you have a hip injury. That's called prevention, which is somewhat of great value. So that's another reason to visit with a physical therapist. Just 1 or 2 visits, if you are active, or even if you're not active, and ask your therapist, hey, could you evaluate me? Are there any restrictions I have or any weaknesses that I should address now to prevent an injury down the road? Just for your information, and thank you for watching.